Robert Moffit is a health policy expert at the Heritage Foundation and says that the government needs to get out of the way. So, Bob, this is an example of what happens when it does?
Well, I think what we have to do is we have to fix the rules for the market. There is no effective market right now for health care. Most Americans don't own their own health insurance policy. Most Americans have very little control over their health care. So as a result, we don't have a normal functioning market where health care plans, health insurance companies are accountable.
All right, but nevertheless, whether it's done by the government in whole or in mass, certainly with national health care, even the president must be reading the writing on the wall and saying it's going to be a tough sell. He's apparently conducting an interview with PBS where he says that August deadline isn't a hard and fast one. It could slip beyond that. What do you make of that?
Well, I think what's happening is this, is that they've put together $2 trillion babies, a House bill that is 1,018 pages, a 615-page Senate bill. It's chock full of all kinds of stuff, including huge spending, mandates, fines, penalties, a lot of things that many Americans will find very unpleasant. And as a result, I think what's happening here is that he's getting blowback from a lot of moderates in Congress. At the same time, the Democratic leadership is very concerned that if they don't push this thing through, people will have a chance to actually read these great big bills, and they're not going to like what they read.
You know, Bob, I sometimes wonder whether there might be a method, though, to the government madness that maybe, much as was the case in '93, a lot of the insurance companies and the drug companies police themselves, at least for a while, started reining in their price increases and the like. And we had, for a considerable period in the 1990s, tame medical-related inflation. Is the case of CIT an example of that? In other words, if private players, in this case bondholders to a major lender, can work out or sort out their grievances, maybe the key players in healthcare can, and maybe we can avert or avoid government interference.
Well, my whole feeling about this is it's not, you know, the insurance companies, or the pharmaceutical companies, or the hospitals working out, you know, whatever it is they have to work out. What we have to do, and what Congress is not prepared yet to do, is to actually transform the health insurance market from a payer-driven system to a consumer-driven system, where individuals and families actually control the dollars in the system. And what that means, in effect, is this. If you get health insurance through the place of work, that's great. But if you can't get health insurance through the place of work, you should be able to get a tax credit, or if you're lower income, some kind of direct assistance to have your health insurance or keep your health insurance from job to job. That way, if Americans can control the dollars, they will make these health insurance companies accountable. Health insurance companies will be forced to compete directly for consumers' dollars, and we'll start to have a more rational system. We can't have,
you know, it might be more rational
economy
to tell someone, look, you're going to get credits to get health insurance, but they could still insist, well, you know what, I'm not going to, credits or not, I'm not going to buy it. There's still going to be those determined, I suspect, millions who will not budge.
Well, some won't, but the point is that what we will have is a situation much better than we have today, which is simply because you lose your job, you won't necessarily lose your health insurance.
Gotcha.
And if you look at the real problem here, most people who are uninsured are people who had coverage, but they lost it, largely because of a job change, and largely because we don't have any portability in health insurance. We have portability in auto insurance, homeowners insurance, life insurance, but not health insurance. That's crazy. We have to change that.
And you hit on, I think, the core of the problem. Bob Moffit, thank you very, very much.
Thank you.